Welcome to the breastfeeding promotion and support in a baby-friendly hospital. Session 6. How milk gets from breast to baby. Objectives. Identify the parts of the breast and describe their functions. Discuss how breast milk is produced and how production is regulated. Describe the baby's role in milk transfer and discuss breast care. In normal breastfeeding, there are two elements necessary for getting milk from the breast to the baby: a breast that produces and releases milk, and a baby who is able to remove the milk from the breast with effective suckling. The manner in which the baby is attached at the breast will determine how successfully these two elements come together. If the milk is not removed from the breast, more milk is not made. On the outside of the breast, you can see the areola, a darkened area around the nipple. The baby needs to get a large amount of the areola into his or her mouth to feed well. On the areola are the glands of Montgomery that provide an oily fluid to keep the skin healthy. The Montgomery glands are the source of the mother's smell, which helps the baby to find the breast and to recognize her. Inside the breast are fat and supporting tissue that give the breast its size and shape. Nerves, which transmit messages from the breast to the brain to trigger the release of lactation hormones. Little sacs of milk-producing cells or alveoli that produce milk. Milk ducts that carry milk to the nipple. The baby needs to be attached to compress the milk ducts that are under the areola in order to remove the milk effectively. Surrounding each alveolus are little muscles that contract to squeeze the milk out into the ducts. There is also a network of blood vessels around the alveolus that brings the nutrients to the cells to make milk. It is important to reassure mothers that, that there are many variations in the size and shape of woman's breast. The amount of milk produced does not depend on breast size. Be sure to tell every mother that her breasts are good for breastfeeding and avoid frightening words like problem. Breast milk production. The first stages of milk production are under the control of hormones or chemical messengers in the blood. During pregnancy, hormones help the breast to develop and grow in size. The breast also starts to make colostrum. Two hormones, prolactin and oxytocin, became important to help production and flow of milk. It usually takes 30 to 40 hours after birth before a large volume of milk is produced. Colostrum is already there when the baby is born. Prolactin is a hormone that makes the alveoli produce milk. It works after a baby has taken a feed to make the milk for the next feed. It can also make the mother feel sleepy and relaxed. It is high in the first 2 hours after birth. It is also high at night. Breastfeeding at night allows for more prolactin secretion. Oxytocin causes the muscle cells around the alveoli to contract and makes milk flow down the ducts. This is essential to enable the baby to get the milk. This process is called the oxytocin reflex or milk ejection reflex or letdown. It may happen several times during the feed. Soon after the baby is born, The mother may experience certain signs of the oxytocin reflex. These include painful uterine contraction, sometimes with a rush of blood, a sudden thirst, milk spraying from her breast, or leaking from the breast, which is not being suckled, feeling a squeezing sensation in her breast. When the milk ejects, the rhythm of the baby's suckling changes from rapid to slow deep sucks and swallows. Seeing, hearing, touching, and thinking lovingly about the baby helps the oxytocin reflex. The mother can assist the oxytocin to work by feeling pleased about her baby and confident that her milk is best, relaxing and getting comfortable for feeds, expressing a little milk and gently stimulating the nipple, keeping her baby near so she can see, smell, touch, and respond to her baby. If necessary, asking someone to massage her upper back, especially along the sides of the backbone. Feedback inhibitor of lactation, or FIL. You may have noticed that sometimes milk is produced in one breast but not the other, usually when a baby suckles only on one side. This is because milk contains an inhibitor that can reduce milk production. If milk is not removed and the breast is full, this inhibitor decreases production of milk. If milk is removed from the breast, then the inhibitor level falls and milk production increases. Thus, the amount of milk that is produced depends on how much is removed. Therefore, to ensure plentiful milk production, make sure that the milk is removed from the breast efficiently. To prevent the feedback inhibitor of lactation from collecting and reducing milk production, make sure that the baby is well attached. Encourage frequent breastfeeds. Allow baby to feed for as long as she or he wants at each breast. Let the baby finish the first breast before offering the second breast. If baby does not suckle, express the milk so that milk production continues. The baby's role in milk transfer. The baby's suckling controls the prolactin production, the oxytocin reflex, and the removal of the inhibitor within the breast. For a mother to produce the milk that her baby needs, her baby must suckle often and suckle in the right way. A baby cannot get the milk by suckling only on the nipple. The next two pictures show what happens inside a baby's mouth when he or she is breastfeeding. Picture 1 shows good attachment. The nipple and areola are stretched out to form a long tip in the baby's mouth. The large ducts that lie beneath the areola are inside the baby's mouth. The baby's tongue reaches forward over the lower gum so that it can press the milk out of the breast. This is called suckling. When a baby takes the breast into his or her mouth in this way, the baby is well attached and can easily get the milk. Picture 2 shows poor attachment. The nipple and areola are not stretched out to form a tip. The milk ducts are not inside the baby's mouth. The baby's tongue is back inside the mouth and cannot press out the milk. This baby is poorly attached. He or she is suckling only on the nipple, which can be painful for the mother. The baby cannot suckle effectively or get the milk easily. How to decide if a baby is well or poorly attached? These are the signs of good attachment and poor attachment. You need to be able to decide about a baby's attachment by looking at the outside. These pictures show what you can see on the outside. This picture shows signs of good attachment. The baby's mouth is wide open. The lower lip is turned out. The chin is touching the breast, or nearly so. More areola is visible above the baby's mouth than below. These are the signs of good attachment. If you can see all these signs, then the baby is well attached. When the baby is well attached, it is comfortable and painless for the mother, and the baby can suckle effectively. This picture shows signs of poor attachment. The mouth is not wide open. The lower lip is pointing forward. May also be turned in. The chin is away from the breast. More areola is below the baby's mouth. You might see equal amounts of areola above and below the mouth. These are the signs of poor attachment. If you see any of these signs, then the baby is poorly attached and cannot suckle effectively. If the mother feels discomfort, that is also a sign of poor attachment. The action of suckling. When the breast touches the baby's lips or the baby smells the milk, he or she puts their head back slightly, opens their mouth wide, and puts their tongue down and forward to seek the breast. This is the rooting reflex. When the baby is close enough to the breast and takes a large enough mouthful, the baby can bring the nipple back until it touches the soft palate. This stimulates the sucking reflex. The muscles then move the tongue in a way from the front to the back of the mouth, expressing the milk from the ducts beneath the areola into the baby's mouth. At the same time, the oxytocin reflex makes the milk flow along the ducts. The baby swallows when the back of the mouth fills with milk, the swallowing reflex. The rooting, suckling, and swallowing reflexes happen automatically in a healthy term baby. Taking the breast far enough into his or her mouth is not completely automatic, and many babies need help. A baby who is sleepy from his or her mother's labor medications, a premature or ill baby, may need more help to attach effectively. Signs that a baby is suckling effectively. If a baby is well attached, he or she is probably suckling well and getting breast milk during the feed. Signs that a baby is getting breast milk easily are: the baby takes slow, deep sucks, sometimes pausing for a small time. You can see or hear the baby swallowing. The baby's cheeks are full and not drawn inward during a feed. The baby finishes the feed and releases the breast by himself or herself and looks contented. These signs tell you that the baby is drinking in the milk, and this is effective suckling. Signs that the baby is not suckling effectively. If a baby makes only rapid sucks, makes smacking or clicking sounds, has cheeks drawn in, fusses or appears unsettled at the breast, and comes on and off the breast, feeds very frequently, more often than every hour or so every day, feeds for a very long time, for more than an hour or every feed, unless low birth weight. Baby is not contented at the end of the feed. These are the signs of that suckling is ineffective and the baby is not getting the milk easily. Even one of these signs indicates that there may be a difficulty. Artificial teats and suckling difficulties. Artificial teats and pacifiers may cause difficulties for the breastfeeding baby. After suckling on an artificial teat, a baby may have difficulty suckling at the breast because there is a different mouth action. The baby may come to prefer the artificial teat and find it difficult to breastfeed. Use of pacifiers may reduce the suckling time at the breast, thus reducing the breast stimulation, milk production, and milk removal. Teach mothers how they can keep milk production plentiful. Help the baby to breastfeed soon after birth. Make sure the baby is well attached at the breast and do not give any artificial dummies or teats that would confuse his or her suckling and reduce stimulation of the breast. Breastfeed exclusively. Feed the baby as frequently as he or she wants, usually every 1 to 3 hours for as long as he or she wants it feed. Feed the baby at night when prolactin release in response to suckling is high. Breast care. Teach mother how to care for their breast. Clean the breast with water only. Soaps, lotions, oils, and Vaseline all interfere with the natural lubrication of the skin. Washing the breast once a day as part of the general body hygiene is sufficient. It is not necessary to wash the breast directly before feeds. This removes protective oils and alters the scent that the baby can identify as his or her mother's breast. Brasiers are not necessary, but can be used if desired. Choose a brasier that fits well and is not too tight. Session 6 Summary. Size and shape of breast are not related to ability to breastfeed. Prolactin helps to produce milk and can make the mother feel relaxed. Oxytocin ejects the milk so that the baby can remove it through suckling. Relaxing and getting comfortable, seeing, touching, hearing, thinking about baby can help to stimulate the oxytocin reflex. If the breast gets powerful, feedback inhibitor of lactation will reduce milk production. Milk production only continues when milk is removed. The breast makes as much milk as is removed. Early feeding and frequent feeds help to initiate milk production. Signs of good attachment includes chin touching breast or nearly so, mouth wide open, lower lip turns outwards, areola more visible above than below the mouth. Signs of poor attachment includes chin away from the breast, mouth not wide open, lower lip pointing forward or turned in, areola more visible below than above or equal amounts. Signs of effective suckling: slow, deep sucks and swallowing sounds, cheeks full and not drawn in, baby feeds calmly, baby finishes by his or herself and seems satisfied, mother feels no pain. Signs that the baby is not suckling effectively: rapid shallow sucks and smacking or clicking sounds, cheeks drawn in, baby fusses at breast or comes on and off, baby feeds very frequently for a very long time but does not release breast and seems unsatisfied, mother feels pain. Breast care is important. Breasts do not need to be washed before feeds. Mothers who are not breastfeeding need to care for their breasts until their milk dries